Does spinal decompression help with herniated disc? And the answer, yes, it does. So let's talk about first what a herniated disc is. A herniated disc, we think of a disc as a jelly donut. There's like 18 rings of cartilage that hold in this very viscous material in the center here. And what happens over time is that we get a breakdown of the cartilage inside here. It gets dehydrated and it's more susceptible to injury. When it does, a herniated disc is where we get this bulging back of the disc itself. We can see it happening right here. And it can or cannot, and a lot of times it does, is pinch the nerve. And that's where you'll get leg pain, weakness, numbness and tingling, and those kind of things down the leg. And they call that, in layman's term, sciatica. So when we're doing spinal decompression, we're essentially, a lot of time we have the patient face down, and what we're going to do is we're going to be distracting the spine here. And what that does is we're distracting it. It causes something called a vacuum phenomena. So it actually works to kind of suck that disc material back in, and we allow it to heal in its normal state back in where it is. So we're doing some pumping mechanisms of that disc to kind of get it to work that way. We're also reestablishing that pump mechanism. As I've talked about in other videos, that's where we're doing the pump of the disc, which helps to suck the nutrients, the oxygen, and the vital water that's needed in order to help make a disc hydrated and healthy. And if we can get that to expand a little bit and get that disc to suck in, that's where spinal decompression will come to benefit you. If you think you're suffering from a herniated disc, then come on in and we'll be able to evaluate you and see if you're the appropriate candidate for a technique like spinal decompression.